hope you're all doing well out there. I've been asked to share my professional opinion on some of the claims being made by President Trump and Robert Kennedy Jr. regarding this conversation around autism and vaccines and pain medication. And I've been asked to share my opinion based on my previous experience in healthcare, but I also want to share my opinion based on my psychic perspective, which I think could be very valuable to a lot of people, whether you know someone who has a certain medical diagnosis or not. So I've been working in healthcare for over 10 years. Since I've been 16, I worked as a certified nurse aide in high school. There was a great program in Texas. So I've been in different departments, in different hospitals across different states. I've been in the nonprofit and the private sector, the public sector. I've seen it all. I've been, like I said, different departments from ER to ICU to research to international health. Medicine and health is not a one-size-fits-all model. Now, the medical, advice, nutritional advice is a one-size-fits-all model in the sense of like, yes, you eat your veggies, you eat your protein, you have a balanced diet, it's going to make an impact on your health, you move your body daily, those are obvious things. But in terms of other things within health, it is not a one-size-fits-all model. There are people that I know, younger than me, ages 22 to 25, who, for example, got the COVID vaccine between 2020 to 2022, who have had horrible side effects, seizures, really messed up things that should not have been happening. And also some who discovered autoimmune diseases that were once dormant or were not supposed to be activated, became activated after they got their vaccine. On the other hand, I've met people who have had absolutely no issues with it. No matter how much research has been done, people can still experience the other side of the coin. Life, obviously, this is life, okay? So people can have one extreme from something they experienced within the health industry and other people could benefit from it. It's kind of like the idea of knowing like, okay, there are good and bad people in this world, right? There are people who have good intentions and people who don't. Everything in this life kind of stems from a polarity and a duality so that we can all not be divided, but learn from each other from those differences. Agree to disagree, okay? A little bit of a channeling coming through right now. Can't help it. But yes, so we have to understand health, medical industry is not a one-size-fits-all model. What works for some people might not work for others. But when you are a pregnant woman, anything you ingest could cause a problem. You just have to be aware. Okay, so between 2017 and 2019, I was a case manager for the Illinois Breast and Cervical Cancer Program. And during that time, I was seeing women of all different age ranges across different trimesters and stages in their pregnancy, some that already had children in the past as well. And what I discovered is that every single mother would have a different reaction to different basic foods and different things. So some doctors were prescribing pain medication while others were prescribing other kinds of brands or other modalities or tools for these women, remedies, if you will. So something I need you guys to all understand is that, again, I reiterate, health is not a one-size-fits-all model. Medicine is not a one-size-fits-all model. The regimen is never going to be the same, especially for a pregnant woman. Other than the obvious consuming fruits and veggies and protein, like everything else, it goes out the window because it depends on you. Okay, now for the psychic spiritual perspective, okay? And this might not make a lot of sense to some of you, but take it if it resonates. It's not necessarily supposed to be something that makes sense, but this is just what I found in the work that I've been doing for the past couple of years, the messages that I've been receiving, and the over 1,000 now reviews that I have. So tough pill to swallow. Some people that have certain medical diagnoses in this lifetime that we don't understand, people who were born with certain medical ailments or physical disabilities, some of these souls, not everyone, but some have signed up to have that experience on Earth. It could be due to karma, it could be due to healing generational things, it could be due to a symbiotic mutual relationship with other souls. Not just for the benefit of that soul, but also for the surrounding souls, the people in their life that are going to be impacted by them, that are going to help them, that are going to learn from that experience with someone who is autistic. So it doesn't really make sense right now, but stick with me here. Everything that is alive on Earth right now, you guys, is a symbiosis of some type of relationship. This is literally elementary school science talk right now. there are some creatures and animals in this world, for example, that have parasitic relationships. You ingest a tapeworm, it's obviously going to harm your body. But then there are other beings that actually have mutualistic relationship. A fish that's always around a shark, for example, following it everywhere and feeding off of that ocean debris, or those little tiny fish that are constantly around whales. So humanity works the same way, unbeknownst to many of us. Before we are born, we create certain soul agreements to experience certain things. It could be an overarching lesson, a generational type of lesson. It could be past life karma. We're going to forget this when we're born because the point is to experience, right? Someone who is autistic, they probably didn't get autism just because of a vaccine. It could be related to other things. And remember, we're in a multidimensional reality. So other reasons, other things could be happening. Life is not linear, you guys. We are in a multidimensional reality experience, and there is always more than one reason to why things could exist and happen. We have to be open to understanding that. We all have different paths.